So women and testosterone. So women have a testosterone level.
Yes, they do. Matter of fact, testosterone is important in every single decade of a woman's life. And most women don't really know that they have testosterone. I always think of that as man, the big muscle man. But actually testosterone, I love talking to women about testosterone because it's really important. It's actually one of the most important hormones for women. Yes. And they start losing the testosterone in about the mid-20s. So by the time they see me and they're 40-something years old or older, they've been deficient in testosterone for quite some time. So when I replenish it, it makes them feel better. It helps with fatigue, helps with weight loss, especially abdominal weight gain. That kind of gets a little stubborn abdominal weight gain. Helps with sleep, which women love to sleep. I mean, when you're not sleeping well, you're not feeling well. So it helps with sleep, and then it has all these, I guess I'd call them more subtle, not symptomatic relief, but very beneficial health benefits. Testosterone is good for the brain, the bones, the breast, the heart. Helps prevent breast cancer, helps prevent Alzheimer's, helps prevent cardiovascular disease, which is the #1 cause of death in women. So if we're able to prevent probably the #2 cause as well, breast cancer, and cardiovascular disease, the #1 killer, we're doing women.
So testosterone is good for the heart.
It is. It's good for the heart, good for the brain, good for the breast, and a major component of strengthening the bones. Matter of fact, there's a study that showed that elderly women on testosterone had an 8.3% increase in bone density while on testosterone therapy, whereas normally women are losing bone every single year when they're not on testosterone or estrogen or both.
So are these women putting on creams for testosterone?
It depends on what's best in our individualized treatment for that particular patient. Some use creams, some use injections once or twice a week, and some prefer to get pellet insertions in combination with estrogen, where they need to have that procedure, which is a little minor procedure, about every 4 to 5 months.